And even there is a discrepancy in time that she joined the lecture on time, and I really thank you. I thank her. So, welcome you all to the Zoom meeting app for participating in the 45th virtual lecture of the lecture series on the theme of life expectancy and health expectancy of Roma communities in Europe. And we have eminent speakers today, including Dr. Paola Di Giulio. She is a research scientist at the Vienna Institute of Demography and Austrian Academy of Sciences. She earned her degree in statistics from the University of Rome La Sapienza and her PhD degree in demography from the same university. Before joining the Vienna Institute of Demography, she held a position at the University of Rome La Sapienza and the Max Planck Institute for Demographic Research in Rostock, Germany. And we have another speaker, Lina Lasar. She is also a doctoral researcher at the Vienna Institute of Demography, Austrian Academy of Sciences. Prior to joining Vienna Institute of Demography, she worked as a research assistant at the Dondiano Research Center at Bocconi University, as well as at the Vienna University of Economics and Businesses, from where she accomplished her master in socioeconomics. So the subject of today's discussion attempts to highlight the demographic data of Roma communities, especially life expectancy and health demographic data, including birth, death rates, and mortality and morbidity data, health-related behaviors. These are the very important. It's a very important subject, and I think it is the exigency of time in Europe. Because Roma have been the most disadvantaged, poorest, and a marginalized community, though the largest community of the largest ethnic minority of Europe, with a sizable population of 15 millions in Europe. So it is an arduous endeavor and a strikingly challenging to collect and analyze the demographic data, especially related to the Roma communities, because of a myriad reasons which are peculiar to Roma. Not the peculiarity of the subject, but the peculiar to the Roma community. There is a lack of official recognition of the community in different European countries. There is an issue of statelessness, resulting in the exclusion of data from national consensuses and the limitation of official statistics. You also may be aware that the historical discrimination, racial stereotypes, and anti-Gypsyism causing distrust in government institutions, which forces the Roma to hide their identity. Because when they reveal their identity, they are being discriminated in every sphere of life. So when they reach when they succeed in the professional career or professional life, they try to hide their identity because of the perennial discrimination and the prejudices attached against them. So other obstacles also, there are other obstacles, including the diversity within the Roma population, diverse subgroups with the different levels of integration and social circumstances of the community in European societies. That causes difficulties in assessing and engaging with the the communities due to the factors like low literacy and precarious living situations and a constant transnational migrations. Moreover, there is also the legal restriction as uh, as well on collecting ethnic demographies in countries like Germany and France, and data minimization that also allows the demographer to gather only necessary data. So a lot of restrictions, a lot of the constraints faced by the demographers, especially who are trying to collect the demographic data of the Roma community in Europe. And the demographic study of Roma is indispensable, as I mentioned, because you know that the European economies are projected to be precarious because of aging population, lower birth rates, and other negative demographic trends. The proportion of the people of working age in the European Union is shrinking. It is going down and down. And while the number of older people is going up, so that is posing, a very serious threat and a great threat to the economies of the Europe as a whole. The such developments are likely to have profound implications not only for individuals but also for European economies as a whole. However, the Roma remain the youngest, most vibrant, fastest growing section of Europe's population. In every country of Europe, Romani people constitute a large chunk of the working age population. So the Roma can be the savior of European economies if they are being, means they are if they are being provided and positively integrated in the mainstream society. And even though there are a lot of initiatives by the European Council and and the European Commissions, they devise the different frameworks to integrate the community in the mainstream societies to uplift their socio-economic situations and improve their life expectancy and the demographic that our speaker will speak today. So now I would like to stop here um, and I request the chair, Dr. Mala 𝒂𝒊𝒎𝒆𝒓, to proceed the lecture. And Dr. Mala Kapoorji is a retired professor at the University of Delhi. She is a well-known sociologist and gerontologist and social health and development social scientist. And she is an independent consultant with the national international organizations like United Nations, and she is the guest lecturer in the PhD program at the University of Macerata, Italy. And there are a number of significant publications on gerontological concerns, aging issues, dementia care, elder abuse to her credits. So now I request ma'am to proceed with the lecture. Thank you very
much. Good afternoon, good evening to all, part of this 45th virtual lecture of the ongoing series of Center for Roma Studies and Cultural Relations and of Indian Council for International Cooperation. I'm happy to be associated with this and invited to chair the session today, as the topic is very close to my heart. My work since last 3 decades is associated with issues of demographics, diaspora, and emerging concerns related with healthy life expectancy that is pertinent when we discuss well-being of populations, and especially when they are deeply impacted with many societal factors as a result of being ethnic minority. Roma community in Europe presents various aspects of resilience when faced with many challenges since a very long time. Issues of migration and settlement have drastic effect on well-being, and when populations go through experiencing circumstances of marginalization, discrimination, and social isolation for ages, thus denied their rights to dignified life, then life expectancy is bound to be affected and constrained. It is no surprise that in the contemporary times, when different regions are progressing with improving various development parameters, Roma community has issues confronting poor outcomes in education, employment, health, and housing that pivotally show lower life expectancies compared to the global scenario. It is observed and documented that Roma people will die 10 or 15 years earlier than most Europeans. And Roma people are less likely to be vaccinated, have fewer opportunities for good nutrition, and experience alarmingly high rates of illness. Their mortality and morbidity status is high, and these are matters of serious considerations. I'm very glad we have two learned speakers to share their thoughts on these concerns, which are relevant and a lesson for sociologists, historians, political scientists, health community, and all interested in development and demographic aspects. The topic for today is very meaningful to guide scholars for further research to critically view significant dimensions of lifespans and environmental factors, as well as reflect on solutions for improving the situation. I eagerly await their presentation, and so would all of you as part of this webinar. I invite our speakers to share their thoughts, and we will have discussion and interactions after listening to them. So may I invite Dr. Paola to start off with her presentation?
I will have some words first, and then Lina Lasar, my colleague, will share her presentation.
Okay, sure.
Maybe Lina can already share the screen with the first slide.
Yes, hello to everyone, and thank you for the invitation. Also from my side, I will share the slides. Just one moment, please.
While Lina is preparing the presentation,
yes,
I can
I'm sorry.
No problem, Lina. So, as I said before, I'm very happy to have this opportunity to present our work in this setting. It will be especially interesting for us because you will see we have a lot of numbers, and we will show you what is the result of this analysis. And we really hope that there will be a lot of possibilities for discussing the results and also to find way of interpreting them. But first, a little bit of introduction about the project. And I am part of both Lina and me. We are from two researchers from the Vienna Institute of Demography that is located in Vienna. It is a part of the Austrian Academy of Sciences. This is relevant for this talk because two demographers will speak with you, and I'm really grateful for this wonderful introduction from both the speakers before, because they really touched on several important points of this presentation and in general of the research connected to the Roma people. So the biggest minorities in Europe, with extremely big disadvantages in several aspects of life. These the numbers that were just told, so 10 to 15 years of lifespan less than the general population, than the Euro population. This is extremely much. So if we think that the first condition for well-being and for thriving in life and working and having families and children is to be alive. So minorities, the Roma minorities in Europe have these very big disadvantages of enjoying a much shorter lifespan. But these data that you mentioned, they were collected with several different measures and with several different instruments. We will provide instead a measure that is called the life expectancy. And it is an instrument that it is results that is extremely, let's say, just a very demographic analysis, in the sense that the data and the survey that we use, they were specifically designed for this. And Lina will tell you so much more details about this. And I will tell you a little bit about the project. The project started in 2020 when the Fundamental Rights Agency, that is also located in Vienna, contacted us specifically in the figure of the principal researcher, that is Mark Louis, also the head of our research group, because they wanted to estimate life expectancy of Roma people. So not just lifespan or the mean age at death, but a real indicator of life expectancy. And they knew that there is a possibility to calculate this by means of demographic surveys. They were conducted surveys, they could collect data, and we were able to ask for the inclusion of two, but one information. With just one information, demographers are able to identify the main variables that are behind the calculation of the lifespan. And the project went on since 2020 and ended up after 2 years. So this first round, let's say, ended up after 2 years with a recommendation of the European Union for a goal. And this goal was the increase of the life expectancy of the Roma people by at least a certain number of years, because these results were so relevant that they wanted to include it as one of the recommendations. What is a very big goal and a very big achievement of demographers, because usually demographers they provide the information, but they are rarely with difficulty listened by politicians. So nowadays, the demographic problems, even of the general populations, are becoming so relevant that it's not anymore possible to ignore demographers. And for the Roma people, this was really a big story of success. So Lina will tell you now something about the results that we have, with some informations about quantitative aspects of the Roma population. But we would be, as I said at the beginning, we would be really very grateful to have from you in the audience a help in the interpretation of these results, because they are extremely rich and they are extremely different. You will see differences between life expectancy, not only among the Roma people in Europe, Roma and travelers people in Europe, but also with the general population. And some of these results are truly surprising for us. So if Lina is ready with the presentation, I could ask her to start, and we will both be here for answering questions. Unfortunately, I think our colleagues could connect later, I'm not sure, but the colleagues that are also participating in the project. So, but in the moment, I don't see them around, because there was this time change that was a little bit interfering. So, Lina?
Thank you very much, Paola, for the introduction, and thank you everyone for inviting me and us. It's a great honor, and I hope that it's going to be also interesting for you. I'm having a bit of troubles to share the presentation on the screen. It worked earlier.
If you want, you can send me. I can share.
I can share the presentation, Lina. Should I try?
Okay, yes.
And then you have to tell me next, please. So I know you need
yes. I don't know. It worked earlier, but now it does. I don't know. I'm very sorry for these technical difficulties.
Do you see the presentation now?
Yes.
Yes.
Just a moment. I'm in presentation mode.
but it's the population dynamics and human capital.
Oh, sorry, this is the wrong presentation.
Yes.
Because I have it open here. And I'm going. Yeah. Lina? Do you see it?
No.
No.
Then let me see. I will try again. Okay, but now you should see it.
Yes.
Okay, just a
Yes.
moment. I will go in presentation mode. It's a little bit slow. Okay. Done.
Okay, thank you very much, Paola, for sharing the screen. So I am going to talk about the life expectancy and health expectancy of the Roma populations in Europe. And as an introduction, as you already said, the basis for it, but some quantitative numbers also on influencing factors on life expectancy and also health expectancy. And namely, we look here at discrimination, harassment and housing issues, education, and findings from the Fundamental Rights Agency. If you can go next, please. So, as you said, Roma are the Europe's largest minority, with approximately 12 million people, and around 6 million are EU citizens. We don't know real numbers because in some countries they're included in the census, in some they don't. In the census, they don't even ask for it. And also, it was already mentioned that a lot of Roma, even if it is asked in the census, they're not claiming to be because of fear of harassment and no trust in public institutions due to also ongoing discrimination since hundreds of years. Half of these the people who live in Europe are EU citizens, so approximately 6 million, but the numbers here may vary. And they are affected by poverty and material deprivation, lower levels of education, high unemployment rates. And this probably leads to also poor health outcomes. And in our research, we use Roma as an umbrella term for a lot of diverse groups. You see them here on the screen. There are also, of course, others. And it also reflects this cultural and linguistic heterogeneity within the Roma populations, but it's also a heterogeneity across all countries of Europe, simply because the countries have differences in policies, differences in access to education, in housing, and so on. And we see the results to it later. If you can go on the next slide, please. So these are these two surveys which we base our data on. I'm going to present some findings and then our life expectancy and health expectancy findings. The one is the Roma survey from 2021 from the European Union Agency for Fundamental Rights. And then the other one is from 2019. It's the one is Roma in 10 European countries, and the other one covers 6 countries. I will show you which countries are covered also. It's not all of the EU countries. If you can go to the next slide, please. So the data in itself is from 2019 and 2021. It was, as I said, collected by the European Agency for Fundamental Rights. And it covers individuals who are 16 years and older and who self-identify as Roma. I think this is also something that is very important, that the Fundamental Rights Agency wants also the people to self-identify, not only to be identified as. We have at least 8,000 respondents per survey, and each survey covers more than 700 variables. They have questions on the basic demographics like age, gender, and education, but also socioeconomic status, which we mainly measure with education or income, on health. Also, they have questions on how would they rate their own health, how many illnesses they have, or how many, if they have activity limitations or not. These health questions are based also on the EU guidelines. So in the large EU surveys, like the survey for income and living conditions, with the EU is doing every year, they have the same health questions, so we can compare them, the Roma populations and the national populations or the general populations in the countries. They have questions on self-perceived discrimination, namely, in the last 12 months or in the last 5 years, have you felt discriminated because of being Roma, or also because of other issues or because of other factors like gender or skin color or things like this? And then they also ask the living situation, namely, how many people do you live with? Do you have access to tap water, and so on? And there are also other questions in the surveys. If you can go to the next slide, please. So the sampling was done because there's oftentimes no population register for any of the countries. And so they did an area-based sampling. So within each country, the Fundamental Rights Agency contacted Roma experts that may have been people living in the Roma communities, and then they did this area-based sampling. So they went to the area where they knew that a lot of Roma people were living, and they did then a so-called walks, random walks. So basically, they knocked on the doors and asked if they are allowed to come in or allowed to ask questions, and then they walked from there to other houses. And they, as I said, all of them self-identified as Roma, so it was no identification by the people who did the survey, but by the Roma people themselves. Can you go to the next slide, please? These are the countries that were included. It was the Roma Traveller Survey in 2019. They covered Sweden, United Kingdom, Ireland, and France. And then the Roma Survey 2020-2021 was done in Portugal, Spain, Italy, and then these so-called former East European countries like Czechia, Hungary, Romania, Croatia, Serbia, and Bosnia. And then also they included Greece, and Slovakia did their own survey, but they included also the questions. So this is why it is in violet, but it's still the same survey that they did. Can you go to the next slide, please? Yes, so as I already told you, or also you know, the Roma populations in Europe face discrimination. But it's also important to know how much of it is also being reported. So here we have the numbers on respondents who in the past 12 months felt discriminated against in core areas of life because of being Roma, by country and survey year. And on the y-axis, we see the percent, and on the x-axis, the countries. And so in Portugal, for example, in its PT, we see that this self-perceived discrimination was actually rising from 47 to 62%. from 2016 to 2021. We also have to consider here that 2021 was in the middle of the pandemic. So I think it's also, especially for the health, it's very interesting to also look at the outcomes in 2021. Also in terms of discrimination, because we know from the literature, not only for Roma, but for minorities in general, that if they feel, or if they are discriminated against, and if they also feel discriminated against, they have worse health outcomes due to stress and other reasons. Also, of course, discrimination in healthcare access, for example, in the healthcare sector. If you look at other countries here in the discrimination, for example, Czechia, it's the CZ, it also rose from 32 to 48%. And then in the total EU, 25% of the Roma who were surveyed also reported discrimination in the past 12 months, which is a very high number, I think. But yeah, as you can see, it varies through the countries. So it's not the same in every country. If you can go to the next slide, please. Here we have a bit of a more detailed question. And also it was from the Roma survey in 2019. So it's the prevalence of discrimination in the areas covered by the survey. So it is Ireland, UK, France, and Sweden. And they ask if they were discriminated against by these measures, and it really strikes that in their everyday activities, like entering a shop or going to a restaurant or a nightclub, they face the highest prevalence of discrimination. Especially here we see that Roma women face higher discrimination when entering a shop than Roma men. And the survey average is, I think it's really high with 33%. And then other areas of their daily life, like if they rent or try to buy a house or look for work, they have really high levels of discrimination. And then here in contact with children's school, especially women, Roma women, or maybe Roma mothers probably felt discriminated against because of being Roma. And also, if they are at work, the lowest levels of discrimination they show in healthcare services with 9%, but it's still quite high. If you can go to the next slide, please. And if you look at harassment, I think this is really, it's so striking that the prevalence of harassment is so high. In the Netherlands, for example, it's 83% of Roma reported harassment. I mean, in it, not as many were physically attacked, but still, I think that this hate-motivated harassment, which is hate speech, for example, that it's so high, and it of course also influences their daily lives, and if we talk about health, also their health. And yeah, as I said, it in the Netherlands, it's very, very high. And then the lowest is in Belgium for the travelers with 13%. But still very high, that 13% of the people report hate-motivated harassment in the last 12 months. If you can go to the next slide, please. Yeah, so the next thing we look at if you talk about health is also education. So here it's people aged 20 to 24 who completed at least upper secondary education. We know also from the literature that people who have higher levels of education also tend to live longer. Here's again we can look at it from 2016 and 2021. So in some countries, the education was lower, like in Czechia, it went from 38% of people aged 20 to 24 to 22%. And then in other countries, it rose. So, for example, in Hungary, which is HU, it rose from 32% in 2016 to 41%. So we see also here really country-specific differences and country-specific so that within the countries it's very different if Roma people have more access to education or get more educated from 2016 to 21 or less. And it might also be country-specific policies that are in place. If you can go to the next slide, please. Here we have the children, so between 4 and the starting age of the population to go into education. For example, here it's in Austria, it's 6 years, which is also it's different in every country. Who participate in the early childhood education. So we see in this orange strip the general population. And for example, in France, it's 100% of children are in compulsory education, in early childhood education, I'm sorry, but only 32% of travelers. But for example, in Sweden, with this SE, we see that 90% are in early childhood education compared to 96% in the general population. I just have to take a sip of water. So again, we see that all of the countries, it varies from country to country. But nevertheless, in all of the countries, Roma have lower levels of education or have lower access to education. If you can go to the next slide, please. If you look at housing, here it's the people who live in housing deprivation, also again compared to the general population. And in the EU total, from 2016 to 2021, it went down. So it was 61% of Roma in 2016 lived under housing deprivation. And in 2021, it was 52%. But again, it varies from country to country. For example, in Czechia, it's the second one, is the CZ. It went down from 33 to 7% in 2021. However, for example, in Greece, it's EL. It went up from 50% to 68% in 2021. So it's really different in all of the countries, but in all of the investigated countries, the Roma have higher levels of housing deprivation, which is also a very important factor if you talk about health, because not only it's a human right to have good access to housing, but it's also that, for example, in damp housing or cold housing, their health of the people who live in housing deprivation gets worse. Can you go to the next slide, please? So the studies also that you mentioned suggest that the population of Roma is disadvantaged in health, and these life expectancy numbers of 10 to 15 years is also flying around, but we don't know we don't actually know, because if you can click through, yes, so we have a country variation, not only in housing, discrimination, harassment, education, all these determinants of health, but also in life expectancy. And there are also differences in data quality, and the methods are inconsistent. So we don't know if it's actually that high. And the European Public Health Alliance in 2018, they did a report on Roma health in Europe, and they concluded that it's disjointed and ad hoc information. And so then the Fundamental Rights Agency, as my colleague Paola already told you, contacted Mark Louis and the research group to investigate if it's actually that high and have a demographic method to estimate the life expectancy. If you can go to the next slide. So if you look at the health differentials in which in other studies, here you see the probability of Roma's health report being good or very good. The self-rated health is if they ask how is your health in general, and you can say it's very good, good, mediocre, bad, or very bad. And we see that the Roma who have both educational levels, the Roma report also their health as worse than the neighbors, but especially also worse than in the general population. You see here in the, yes, thank you. No, you can go on. Thank you. And then also the risk of poor self-rated health is higher in all the Roma populations that they investigated. So in the younger ages, from age 18 to 30, the gap is not that high, but especially if in middle and in middle age, from 31 to 50, the gap becomes higher, and then the gap is even larger from 50 or more in terms of self-rated health. And self-rated health is also a good predictor for mortality outcomes. If you go to the next slide, please. So it's a good predictor for mortality outcomes, but there's still, as there's no census, and as there's we don't know how large the life expectancy gap is. So what we use is the orphanhood method. And the orphanhood method is a method to estimate life expectancy from survey data. And it's an indirect method, because the way we would normally do it is for we have the probabilities of dying in each age range. But we don't have that for the Roma population, so it's indirectly. And it's used in countries normally with no complete information about the deaths. And we ask the people if their parents are still alive or not. So it's only collectible for persons who have children, because we ask the children whether their parents are alive. So if you have no children, we cannot ask them. So the persons with no offspring are not accounted for. And then it allows us to have a time trends in mortality by the age groups of the respondents. Because the younger people, if their parents are already died, for example, their parents also must have been younger than if you ask in mid-age, for example. Can you go to the next slide? So these are the questions that we were included in the survey. Is your mother or still alive, or is your father still alive? And how old is your mother or father today, if they are still alive? And then the questions for the women from 15 to 49 was, how many children have you ever born, and how many of these children are still alive? It is to estimate child mortality. And can you go to the next slide? So as I said, we use this information whether the respondents' parents are still alive. And then if you click on, so, and this allows us to estimate a survivorship probability. For example, yes, there's a question.
No, you can go ahead. You can go
Okay,
ahead.
sorry.
After the completion of the lecture, if anyone has a question, they can ask. They can put
Okay,
the
thank you. Okay, I saw someone raising their hand. That's why I asked. Thank you. Yes, from this, we estimate a survivorship probability in an age range. And because human mortality or the survival function is similar for the human populations, we can complete a survival function with the model life tables. And this is what we did. And so we ended up with this survival function, which allows us to estimate the life expectancy. Can you click on, please? So as I said, we have different time trends. And here you see the life expectancy at age 30 for Eastern and Western European countries. So what we can already see is that it is lower in all of the countries, the life expectancy. That Roma women have higher life expectancy than Roma men, which is also similar in general in all of the other populations, that women live longer than men. If you click on, and here it's for the Western European countries, and you can see the same pattern, that the time trend, you see that in all of the investigated countries, the general Roma population has lower life expectancy than the general populations. And Roma women also live longer than Roma men. Can you click on? So here is life expectancy from birth. And on the y-axis, we have the life expectancy. And on the x-axis is again the investigated countries. And we see that in Croatia, Roma women have the lowest life expectancy with 66.9 years. And in the UK, they have the highest life expectancy with 75.8 years. In general, we can see that in the former Eastern European countries, life expectancy of Roma is lower, as is also life expectancy of the general populations. However, in Italy, for example, the Roma is the second lowest, and it's also one of the largest gaps in life expectancy. But it's also that the Italian population has a very high life expectancy compared to also other EU countries. And then for the men, we again see that in Croatia, the life expectancy is the lowest with 61.9 years, and the highest in Portugal with 71.4. However, in all of the investigated countries, life expectancy is lower for the Roma populations than the general populations or the national ones, and it's really strikingly lower. So it's altogether on the average, it's 10 to 15 years. Can you go on, please? So here are the gaps in life expectancy. As I said, in Italy, it's the largest gap in life expectancy, and in UK, the smallest. In Italy, it's 16.8 years, which is really extraordinary. It's really striking that it's so large, but also probably because Italy has high numbers in life expectancy. And then for men, it's a similar picture. In Italy, it's 14.1 years, which is again very large. And in Portugal, it's 5.5 years. We also see it in the health expectancy. The Portugal has the smallest gap, but I will show this in a second. And we can again, okay, sorry.
I'll go back.
We can again see, or we see that in some of the Eastern European countries, the gap is smaller. But then also life expectancy itself in the national populations is smaller in the Eastern European countries than in the Western. Okay, you can go on. Thank you. So there are, of course, some limitations to this study. It's a broad mortality indicator. There are assumptions behind the conversion factors because from these people who report their mothers or fathers alive or dead, we have to convert it into the survivorship probability. And then there are these concept-related biases possible. As I just said, it's also that we capture people who have children and not people who have no children. And the representativeness of respondents' parents. So if the parents are also really their parents, it could as well be that they are adopted, for example, and they don't know it, even though it's a small chance, but it still could be the case. And then we also have to think about the quality and the content of the survey. So if the people, so how it was collected and so on. But there are also potentials, and they're on the next slide. Thank you. That the information can be collected easily. So if you already do a survey and you just have to ask two questions, namely, is your mother still alive or is your father still alive? It's fairly precise data because normally people know whether their parents are still alive or not. We can estimate life expectancy, estimate time trends also in life expectancy, and we can also estimate healthy life years, which we already did. We have preliminary results. I will show you the results, but they may vary, so don't take them as they are for granted. Can you go on? So the health expectancy combines basically life expectancy with health questions. And we have the person years, which are the years lived for each one in a specific time frame. And we multiply it with the proportion of the lifetime spent in good or bad health in each age category. So you can interpret the results as the remaining life years spent in good health. And then we did it with the questions on the limitations. So the question is, for at least the past 6 months, to what extent have you been limited because of a health problem in activities people usually do? And then they can say if they're severely limited, but not severely, and not limited at all. And those who said they're not limited at all, we said that they are healthy. And we looked at those people who say they're healthy and how many years they spent in good health. If you can go on. Here we have the estimates for this health expectancy of the Roma populations. We can again see, so we have data for 2016 and 2019. And we can see that again in all investigated countries, the health expectancy is shorter. So while, for example, in Sweden, the national populations can expect to live another 28 years at age 50, so until 78, the Roma population for the women can expect 5.6 years, which would be 55.6. And this is really a large gap. So not only do the Roma populations live shorter, but also in worse health. And the smallest gap is in Portugal, but I will show you this in a bit. So for the 2016 data, The lowest health expectancy is with 4.1 years, and the highest health expectancy with 12.0 years. And then for the 2019 data, it's different countries. The lowest health expectancy is in Sweden and the highest in France with 9.2. However, the gaps are very large. And then for the men, on the next slide, yeah, thank you. It's a similar picture. So in Croatia, the health expectancy is the lowest with 4.5 years. So again, at age 50, the Roma population the Roma men in Croatia can expect to live another 4.5 years in good health, namely without activity limitations. And the highest is in Portugal with 13.6 years. And if you go on, please. And then here are the gaps again for 2016 and 2019. For women. And so we see that in Portugal, the gap in health expectancy is actually quite small with 0.7 years. And in Czechia, the highest with 13.6 for 2016. And then for Sweden, it's 22.4 years. And so we have to interpret this data or these preliminary findings that in Sweden, Roma women can expect to live, or the gap in their healthy lives is 22.4 years. And if you just think what you can do in 22 years, and you're healthy, it's really, it's an extraordinary gap. And for the men, it's again a similar picture. So in Portugal, it's the smallest gap in life expectancy, in health expectancy. Sorry, and the largest in 2016 is in Czechia, and in Sweden, it's for Roma men. It's again 22.1 years. So even though they're preliminary results, it's striking that it is so large. And then the next slide, please. It's the conclusion already. So to conclude, our results show this extraordinary disadvantage of the Roma populations, both in health and in mortality. And here you again see the differences in life expectancy, in blue for men and in red for the women. Thank you very much again for the opportunity to speak today, and I'm happy to answer any questions that you may have.
Thank you, Lina.
So I request Dr. Kapoor to.
Yeah, thank you very much. Do appreciate all the points you have described and shared. And I think before I make my comments, are there any questions in the chat box which people want some clarifications or things? Zameer, are there any questions? I can't see any.
Hello. Hello. Now you can have any questions, please put across.
Yeah, please add your questions or clarifications required. So meantime, while we are doing, I think very good data has been presented. But to my mind, certain issues come up, and which I think relevant from various perspectives, is how do we close the life expectancy gap? I mean, we know the health status is low, and there is a health gap between the Roma community and other population groups. But the question is, have you observed any specific programs which have been undertaken in specific countries, which have helped over the years to reduce the gap? I mean, do you see something? Of course, we all know that health outcomes require a holistic, cross-sectoral approach. But do you see some good practices or examples which have made a difference?
So as I'm doing my dissertation on this topic, I started to dig deeper also in these country differences.
Yeah.
And it's also a question I would have. Actually, it's for example, why in Roma, in Portugal, the gap in the health and also in life expectancy is so much smaller than in other countries. I'm not very sure actually why this is the case yet. And I yet have not observed some great policies or something in place where they really help to improve this. I've just read some studies because the EU had, you probably know, this EU framework for Roma integration or something like this. And I've read some research that it was not as great as hoped. But I'm not sure. I don't know if Paola wants to add something on this.
Now, this is really a relevant question because we provide the data, no? So, and then I also ask myself, because this target of the European Union recommendation is to cut the difference in life expectancy of the Roma people in half. This is an extremely high number of years, and it should be achieved in 10 years or something like that. It is unbelievable. How do they want to do it? And so first, we must have the data. And Lina presented the results, and this is quite robust results. On the other side, they are based on the survival of the parents. That means that although the method provides also an estimation for the newer, so for the most recent times, so everything that is coming out from the survey and we can really rely on, it is referred to, I think, latest 2015. So the data of the survey, not the estimation of the method. And so fundamentally is to have the data. And then what Lina presented also, that the least discrimination they feel in the public health service. I don't know if you saw this. So what was also surprising to me, that means that they don't feel as discriminated in public health service as in the everyday life. And my impression, and of course it is not the role of demographers to establish policies, but my impression is, of course, that it is not the provision of the health services that is impacting so much the difference in life expectancy. I think when they need, they have the service there. It is really the discrimination in every other, let's say, domain of life. Smoking and also nutrition. Although with smoking, we see that there is not so much difference with the general population, but with the type of nutrition, with obesity, probably these are health behaviors that could be affecting life expectancy. So this is extremely relevant.
Yeah, and, very true.
Yeah, and another thing is what we didn't mention, but it is also part, let's say, of the research, is also this reproductive health. What happens to women around the childbirth? Because this is such a relevant moment, both for women and for children. And everything that is lived in the first years of life, including education, that is so low, it is then an investment and for later life. So if I would have to invest in something, I would have a very long view and start to look at this at the childhood of so at this moment when the people are children and they can still invest, can still receive a lot of help for having a better life later on, and they are mothers. So, and maybe in this way, so one can have some good health outcomes later, but how much later on? So.
Yeah, no, I have been very impressed with your data collection. But, taking it forward in terms of, I don't know the background of people who are participating, but for, many people who are concerned with demography, I think that issues which become relevant are the need for having more longitudinal studies and the need to have more cohort studies. And also, we need more data. And I think that is something which is missing in Roma communities, as well as in other countries also for various ethnic minorities and, sort of disadvantaged groups, is that we are not paying too much attention in collection of data to understand that the difference which arises between life expectancy at birth and life expectancy at age 60. In most countries, we see that the gap between the sex ratios is less when we are talking of life expectancy at birth, and it increases when we talk of life expectancy at age 60 and beyond. So some of these things, I think we could have some discussion if people have some questions. But I mean, as demographers, as health analysts, and also to link up demography with epidemiology, we need much more data to, come out with sort of reports which can help us to understand how the health status and healthy life expectancy can be increased. These are some very relevant issues which your research is pointing towards, and I congratulate you on giving very deep understanding of different data from different countries and between men and women. But taking it forward from there, I think for everybody listening, it is giving us lots of ideas on how to talk of different dimensions in it. So do we see any questions or any clarifications required?
Yes. Yes, Mr. Orhan, he has a question.
Yeah, would you read out the questions and
he can directly put forth the questions to the speaker. Yeah, Orhan.
I think there's a question on the reason why Bulgaria is not part of the survey.
Orhan, you can unmute yourself.
Yes, I'd like to. I was just curious why Bulgaria is not a part of the survey, since Bulgaria has a very major Roma population as a part of the total population of the country.
Lina, can you answer this question?
It was a decision by the Fundamental Rights Agency, and we don't clearly know why Bulgaria was not included. But yes, I also think that it would be great if for the next service Bulgaria could be included, simply because there's a large Roma population living there also, yes.
Thank you.
Yeah, Orhan, go ahead.
Yeah, I think my microphone is not muted now, right?
We can hear you.
Okay, good. Thank you very much to Paola and to Lina about this work you have done. I will speak now as a journalist, and I speak as a Rom. I have my family. We are here in Holland. My mama today, she's still 93. Her mother was living 104, but my uncles, all they die exactly as you said, 59 or 61. And I am looking at the family, how long we will live. Like me, today I'm 70, and this gap is not, relevant for me. I believe that I will follow my mother's line, not my father's line. But this research and this idea about how we will survive, how we can have a better life, and how the life expectancy can be extended, I would love an institution to tell me which kind of policies de facto that European Union and in general European institutions and Roma have to develop and work on this. Because in the last 30 years, as I do participate in various meetings, very important meetings about our life, demography, and so, there was never answer on what we should do now. If I see these diagnoses that you have been talking about, so Roma are facing apartheid in Europe. Roma are totally discriminated in Europe. Children are out of any system to be included in the society as other children. There are examples of very good, say, a vision how some families are doing, but 90% of the Roma are unemployed, and they are not secured in the health system of the European countries. Here in Holland, I know an example of a so-called stateless Roma. And unfortunately, as other countries, they speak about us, Roma, and travelers. Travelers are a social group, please. Once we have this vicious cycle to change who we are, because the Europe still works on right side, on right wings issues. So I believe that with the name of Roma and communities, we might, but travelers still I disagree. Well, here in Holland, I know many cases as a journalist doing my radio patri. There are very often cases that they are refused for the health care. They are refused even to be in the system of healthcare system. These examples shows the status of Roma in Netherlands. The status of Roma in Netherlands is not so good. They mix us with so-called woonwagenbewoners. And that is like people who are traveling and they have no origin. In Holland, there is a very big number of so-called stateless Roma. How a stateless person can get legally in a system of healthcare. And also, of course, one of the most important issues is housing and health. I don't have to explain to you how many millions of children are in the situation to not be included in the education systems. And in the end, I am very careful when we speak about those demographs that are like Roma experts. Can you imagine if I will be an expert of Austrians? Then, that is my problem. And Fundamental Rights Agency, like a cycle, repeating those research, various type of research, academic research. But for example, if I would be you, Paola, I would try to find the part or department of the Austrian government who work on these issues and propose them a cooperation and to work on Austrian Roma. Austrian Roma still look like those because there was a migration, political migration, even in the Balkans and coming especially to Austria. Those Roma are like features of Balkan situation, the situation in Balkan countries. Very bad situation with the legal status, but also with the status of housing and healthcare. I love very much when you speak about self-identity, how one can have a care that first the self-identity is being human, and so on. And this self-identity throughout researches on this kind of data should not be at all related to those research that happened to us during the Eva Braun and so on. You know, we know very well why they did this, why Mengele had made this. So, and then deeper I'm going, you know, look like that we Roma and Germans, looking at the Germans' deep origin, we are look like neighbors or even brothers. And so, and those issues that we left from Second World War and still today, I believe that another qualitative research with another format could reach much more and many Roma. When I listen to Lina Lasar, I know those data from years. They're very similar. I don't see, excuse me, it's personal, but I don't see an innovative research on addressing issues, very important issues about life expectancy, um, health issue, and so on. Do you know that somehow comes to me the idea of a physician? He said to me, Orhan, you Roma, you usually have diabetic disease, you usually have a glaucoma, and so on. So how these type of researches can reach Roma to educate them on the lifestyle and so on. I thank you very much for your attention. And I'm looking to cooperate with you, seriously. Let's make some broadcasting, let's make some kind of conferences, including Roma and so on. In the end, let me tell you also that having this beautiful Indian organization, institution that works with us, Roma, because we are from India. So I visited Hyderabad and a center of yoga and Ayurvedic medicine. I saw their incredible results. So I think that your research could be related also to various alternative medical institutions that would work with the Romani population. We are not going to, we Roma, we don't educate in large number. We don't educate our children what to eat and what to not eat. We eat morning meat. Many families, you know this idea of mechanism that we have. Not being hungry, you have to eat bread, first of all. I've been working in Turkey for the last 5 years. And when I saw a population, a community of 25,000 years, every morning the children are eating first the bread, simple bread. And you can imagine what's happened then later. Thank you very much.
Thank you very much, Orhan. Any comment from Paula?
I can start and then Lina can add something. So first of all, thank you very much. This is extremely relevant also to hear it from you, you know, so this is a testimony of your life that first, so you can have a long, happy life and it is not a genetic thing, no? So you can enjoy life at the same time as being healthy. What is fantastic. And this issue with the policies is so relevant, is so unfortunately, so you saw that there is no Austria in the sample. So there is no, so I don't know if it is the right government where to go. And it's true that this data about Roma people are around since long. But I wonder if this is just an academic type of knowledge, and if this really reaches the people, the people on the street, something like, okay, you see, there is this population. I'm from Italy. I know the situation in Italy. And it is always, or very often, this situation where we say we and them, and they. We and they. So it's completely separated, and it's, I think people from the street do not realize what this means in terms of basic rights, discrimination, and we don't realize. So it's not that it comes to our minds something like, oh, look how discriminated they are. What we say usually is, oh, look how different, or they live differently. But without this connotation that there is a very big injustice behind, So it's not correct that some men or some women are living longer or shorter, not randomly, but because of some situations that can be modified, that can be become an advantage. And as you said, there is this question about the behaviors. And then I have a question for you. But first, but to say someone has to teach the children. You know that in my institute, this Vienna Institute of Demography, is part of a bigger group of institutes, and we have all together, we are pillars of an institute that is called the Wittgenstein Center for Demography and Global Human Capital, because in our research agenda, there is this big underlying, so it's an underlying factor that education is the big key to make our future better. And in a sense, it's true. So if we reach to educate the children, but education in a real sense, not schooling all, to get the children, then we will have better future. And this we see also, education is key also for health and for work and for many, many different domains of life. And I really think that investments should start from there. Of course, for the older people, adults, it must be something different. And this is my question for you. So, because I'm really curious about something and I can ask you. So, when a person in the communities, in the Roma community, is sick, is ill, what do they do? Do they go to the usual doctor? Do they try to heal on their own? Or this kind of habits? We would really love to know what is the process that brings a person from being healthy, unhealthy, and recover, if any. So we know how this works in the usual population, so the general population, because you go to the doctor. The doctor is some 100 meters away, usually from your flat. And this doctor gives us medicines, and we accept this idea that with medicines we become better. And then, if necessary, we go to the hospital. We don't have discrimination, not in these amounts, at least. And so we have complete access to this health system, and we get everything that we need to at least try to become healthy. And how does it work in the Roma communities? So maybe it's a naive question, sorry. You're muted.
May I just barge in here? I think you've raised an important issue of linking up certain aspects. And I would like to suggest to the center, if they can somehow advocate for more interdisciplinary research, which brings in demographers, which brings in epidemiologists, which brings in social scientists to talk of behavioral changes, the health specialists to talk of how to improve health status, policymakers, what kind of social security or financial security can help. So, I mean, the thing is, we need a very holistic approach when we are talking of improving life expectancies. I mean, it relates to how to remove poverty, social exclusion, increase labor force participation, improve education, reduce discriminations, and also how the governments and the European Union can make effective treaties on human rights that provide dignity to the Roma community and respect to Roma people. So it's not something which will change overnight. It needs long-term policies, and a lot of more voices have to be raised to bring attention to some of these issues. I mean, you as demographers are doing a good job to present and highlight what are the differentials and which need attention. But it is for many other discipline experts to link it all together and as a sort of, interdisciplinary work, things need to move forward. So I think it's been a good opportunity to hear you and uh, think about some of these very relevant issues which are coming up. And I'm sure Zameer and their group from the center and the linkages which they have with various organizations would pay more attention to some of these concerns. I don't see any other questions or comments.
Excuse me, ma'am. Sorry, I have one question to
Yes,
the
sure, sure.
speakers.
Yeah,
Actually, thank you very much, Orhan and the chair. If you allow me, I can have one questions.
sure, sure. Yeah, please go ahead.
Thank you very much. Paula, I have the question related to methodology, as the very rightly pointed out by Orhan, as well as the uh, Professor Maladi also pointed out about or suggested the interdisciplinary approach to be incorporated in carrying out such kind of, comprehensive research and survey. My question is, because as Orhan pointed out, we have been seeing these data, the FRA data, almost the same, identical, the repetitive. And so is there because as you know that the problems like absence of official data, that also forces the demographer to rely on the estimation. And you know
True.
that in demographic study, estimation is disapproved, not very much encouraged, So, and the second, the methodological hurdle, as you are a part of this research and you are closely associated with the research. So, I think that you may, in a future survey, you may incorporate. So, there is also the methodological hurdle, uh, which prevents the demographer for collecting reliable and consistent data. Because as you mentioned that you showed in your presentation the life expectancy, that's a very important because it is a matter of life. It is a matter of existence of the community. So in Italy, that is a 15%, and the Netherlands around the 15 and 14% and 16%, and the estimated disadvantage of the 15 years life expectancy lower than the general population. So, means the situation is because I also carried out the research. I have the 400 respondents about the different aspects of the Roma community. I find that the situation is much more aggravated, and that is a more than 20 years in almost different countries because of deep-seated and ingrained racial discrimination. That is a part of it. We look at it every day. We see in the newspaper everywhere. So how European Union? Because I think this is a very important institution And I really appreciate the European Union, the Fundamental Rights Agency, to at least the giving some kind of data, because there is a shortage of data. The populations, and there is a no population because of discriminations, anti-Gypsyisms, prejudices, stereotypes. But it can be more effective if it can refine, means if scholars and scientists like you can refine and redesign the methodology and the designs of the research, because what but what the data these data these data show and demonstrate, the situation is otherwise worse. And so how means the how you can means the how we can expect, because it will help the policy, it helped the different countries of Europe and other stakeholders to design or devise the framework and the policies for the upliftment or the improvement of the socioeconomic situations of the Roma community in the different countries of Europe. So that can play a very important role in improving and enhancing the overall situations of the community, because as you are aware of that. So what are your take on that?
So, as usual, I speak first, then Lina, you can add something if you like. So, what we forgot to tell you is that about the data, because now that you mentioned this, you said about 20 years of difference in life expectancy, is that these methods estimates, because of our choices in every step, what is at least the difference between the life expectancy of the general population and the Roma people. Could be higher. So, but this is a conservative estimate, just to say it is at least this difference, and it might be even worse. But at least this is for sure, something like that. And the innovation actually, so although probably it is not perceived in this way, the innovation of this research is really to be able to estimate a life expectancy that is a number, a single number that comes from estimation of the survival throughout the life course. This is, it was not possible before, and it is possible with this data. It would be fantastic if other data are collected, and there are some difficulties in the field, of course, to collect. So there are some technical difficulties. We are not conducting these surveys, and we are not investing research funds to fund our own survey. So for the moment, we have to live with this data. But what we can do with the life expectancy is then to calculate healthy life expectancy. So the health dimension that is calculated directly based on the length of life and how much part of this life can be lived in good health, because no one wants that we live longer but unhealthier, of course. And this is really, so although it is, it looks almost incredible, but this is the innovation of this. So this data about discrimination, about the social situation of the Roma people, Roma travelers, and also about the health situation, they were already around. So, but this information about the survival of the parents, it is exactly what we asked to include and what the Fundamental Rights Agency is doing. So having said this, I think there is a crucial point that emerged during this webinar, and I'm sure that for some time it will be like that, this knowledge must be translated into action. And this is the crucial part. It is the very, very difficult part, where a lot of actors have to come together. And I don't hear many. So we are since some years in this field. So, but not many years. So we are speaking about 2-3 years of analysis. But before coming to this topic, it is not that this is a topic that is very much present in the research agenda. It's not in our field, I mean, so maybe in other fields. So, and here, maybe it's true that we could really captured the attention of the research field, but also so to translate it in research that is good for action. This is really relevant. But this takes time, no? It takes a little bit of investment. And well, Lina is a good example. It's a fantastic example because she's doing a doctoral thesis on this. And her focus is exactly on this discrimination. I think she got so many new inputs and ideas and even inspiration where to go with her thesis. What do you think, Lina?
Yes, so I wrote down a lot of different ideas, and it's really great to hear from all of you and the different fields or backgrounds that you have. And I do also think that, first of all, I think that it's that not in science, the Roma populations are oftentimes overlooked, and then this that there are often not included in census. I think that Orhan here made a point with the history of especially Austria and Germany, and this that we say that we should not include it, but it's also, I think the Roma communities and what happened in the history is not even acknowledged to this extent that it should be. And I think that it's also important to not only educate maybe Roma populations on their lifestyles, but especially also educate the national populations, what we can actually also do to include everyone in healthcare, but also in education. And to, because the discrimination is coming from the national populations, to also educate them to have a good life for everyone. And it's especially, I also agree that we have to do more interdisciplinary research, which we at the moment have no funding for, but maybe we can apply for some funding. And I'm looking also in Paola's direction now. I think it would be really valuable to do it. Yes. So I really thank everyone for the input to our research and to also my research going forward. I got a lot of different ideas and perspective. So I think that's really great. Thank you very much.
Zameer, may I have a floor?
Yeah, please. Now it is. Yeah, please summarize.
I like very much that Miss Paola is smiling, asking myself if I can. But the situation of Roma in the health field is a political issue as well.
Yes.
Taking this into account, yes, right, I mentioned what's happened with Roma when Mengele was making those research with the eyes of the twins of the Romani children, or however. But in the new history of Europe, don't forget, please, that Romani women were sterilized.
Yes.
You know that in Czech and Slovak Republic. And as well, those Roma communities in various countries, they have trauma on looking at their health, how to survive, to get a better health or the health you have. So this is a very complex issue when, again, Ms. Giulia asked me, or she asked just how the Romani family looks at the health system, at the physicians, ambulance, and so on. Many of them, I was educated to go to doctor because doctor could have good answer for my health. But now in this very moment, I have type 2 of diabetes. And 2 years ago, I stopped to take any medicine, even insulin. And I'm fine because I do know, because I'm educating myself, how I can survive and so on. But children, parents, especially mothers, they are traumatic what's happened to their parents, you know. So how this research can apply on better status of the mind that Roma, first of all, should be educated from very early age, and as well, especially, you know, we Roma, we do care about elderly people very much. We are not putting our mothers and fathers in those houses where someone else has to take care. But that has to be, you know, a new education, new approach, how we Roma can do things. I don't know, this is just idea. I am a dreamer sometimes. It is idea comes to my mind how your institute can work with the Indian Institute, how we can include those probably ways how Indian pharmaceutical companies can help Roma to get the best therapists. My uncle, who died at his 59, he was taking daily more than 8 or 9. I don't want to say 15, but sure. Aspirins about his health. And I was fighting with him. Don't do this. Now in Holland, I see very similar issues. You know, there is an invisible fear how to approach ambulance, a doctor, and so on. Refusal in general, because they are stateless, they have no hope. So I think that this type of research can have an answer how we have to approach Romani communities with education on health, because this is one of the most important topics for the life. Would be good to organize once more a similar a conference and talk about the particular ways how to organize this, how European Commission can give you a grant of €1 million, and then you cooperate with very rich pharmaceutic or however Ayurvedic institutions in India and help Roma. Maybe like that, I don't know. And how the experiences like Miss Kapoor has, and you, how you can make ways to make it happen, because you know very well that the national Roma strategy designed by the European Commission did not work. I'm angry. Okay. I wish you all the best. Thank you very much.
Thanks a lot.
Thank you.
Yeah. So, Zameer, I think it's time to wind up. What do you say? Yeah. So I think it's been very interesting discussion, a follow-up from the presentation of demographic data and the insights which it has given, and how, you know, like Lina said, that it has helped her now to think of what more to do in research. And I think that is one of the purpose of the center too, to kind of encourage further thinking and more disciplinary interactions. And in that sense, I think we have been successful in your mission to bring people together to think of important, relevant, contemporary issues. So I mean, it's important to look at something which you also pointed out. How do we make the demographic data translate into interventional policies? And what kind of strategies can work and what frameworks need to be used? So thank you all for making this an interesting, insightful discussion. And I'll leave it to Zameer now to just close the meeting.
Thank you very much, ma'am. And I really extend sincere thanks to Paula and Lina, and above all, Orhan, to enrich this discussion, and all others who join later, Chipian and Andres and Zelina, and thank you very and Suzanne G. And thank you very much. And it's a very comprehensive, riveting, interesting, informative presentation in terms of data. And data is power. So, and it can not only education, even data can change the life of the people. So, those who have more data are more powerful. So, thank you very much for this informative discussions and lecture. And I request and I expect the future participation of yours in our forthcoming programs and events. And thank you very much. And now it's time to wind up. And thank you very much. Thank you. Bye.
Thank you, Zameer.
Thank you.
Bye-bye. And thank you, Paola and Lina. Nice to know you through this webinar and know about your work. Congratulations and keep doing good work.
Thank you, and thanks everyone for the comments.
Yeah.
Thank you very much. Bye.
Bye-bye. Good luck. Bye-bye.
Bye. Goodbye.
Bye.